Let me give you a brief update. As usual, I'm very, very appreciative that Dr. Mark Kerouac, the President and CEO of Bay State Health Systems, and Dr. Robert Roos, the Chief Medical Officer of Mercy Hospital, Trinity Healthcare, are here, and they will be giving their update, and as we've done before, right after their update, so they can get back to their important duties at their respected medical establishments. We'll take questions immediately, and we continue to work very closely and coordinate with Bay State and Mercy. I also want to thank our lovely sign language young ladies, again, for being here. We appreciate that very much. And I want to thank the continued partnership with AMR, Director of Operations Patrick Leonardo, who is always here. And thank you very much for Governor Baker's Stop the Spread. I know you're very busy up there at the Eastfield Mall with the Thanksgiving holiday, so we appreciate your efforts immensely. New COVID-19 cases total since this ordeal has started has moved us up to 5,887. The MAVEN system, which Commissioner Helen Carlton Harris, the state, reports off to, fluctuates and gives constant updates. So we might get one number late afternoon, early evening, later evening, then it changes. So this is to the best of our ability. But Friday, we had 96 new. Saturday, 119. Sunday, Commissioner Carlton Harris is going to report differently now because it always changes, but start off at 38. So if we go with that, that's 253 for the weekend. And for the week, Helen will go over 532 for new cases. We continue our deliveries to our senior citizens with their home meals, and that's gone well. Unfortunately, Commissioner Carlton Harris has indicated to me that we had 3 new deaths, and again, our thoughts, prayers, and sympathy and encouragement go out to the families that have been affected, losing lost loved ones. Those 3 new deaths will move us up to 136 total. Of that, 59 are white for 43.3%. 31 are black for 22.8%. 43 are Hispanic for 31.6%. And an uptick with Asian, 3, which moves us to 2.2%. Those deaths occurred residential aspects. So now long-term care facilities have totaled 57 deaths. Residential now has moved up to 79 deaths. Again, Commissioner Carlton Harris, and I know Dr. Kerouac and Dr. Roos will tell you, please get your flu shots. They'll elaborate on that. I want to congratulate Commissioner Helen Carlton Harris, Business West Woman of Impact 2020 award winner. Helen, congratulations. As I put in my ad, AKA Meyer, our Dr. Anthony Fauci. Also, Helen and I just recently announced really going to the Office of Racial Equity, our gang intervention prevention initiative, taking it to the streets, as the Doobie Brothers would sing, with the mission. And Brother Johnny, this is much as we've done with Commissioner Clapprood with mental health aspects, moving specialists on the street to see what we get the root causes. And this is an initiative that was done successfully down in Camden, New Jersey, and we're trying to do that to try to diffuse, to try to intervene, to try to prevent gang type aspects and get to the root causes. If something should arise to the fact that the violence continues to be perpetuated, then we'll deal with our federal partnership with the Gang Task Force. But here is to try to hit it 2 prongs. So we're looking forward to that initiative. with the mission being on the street, to help these individuals know there's a better way to go for education and workforce development, mediate, and be able to alleviate that. Important announcement, Oasis Food Bank. John Foley, who does a tremendous job, they usually serve Fridays, but due to the Thanksgiving holiday, it'll be Wednesday. He contacted me Friday evening, which makes perfect sense, so we get people and families in need the food and their meals that they need before Thanksgiving. So again, they've been dealing with about 3,500 families. That is up at Central High School, and I appreciate everybody's cooperation from the school, System Superintendent Warwick, DPW, Director Mcnally, Police Department, Commissioner Clapper. So that usually starts off about 10 to 6 p.m. So this Wednesday for the Oasis Food Bank and John Foley, we appreciate the efforts, and they work with the Food Bank of Western Massachusetts so they get their pre-Thanksgiving meals and foods and meats and milk and vegetables and fruits. Wednesday, Oasis Food Bank, Central High School, not Friday, pre-Thanksgiving. Also continue my discussions this Saturday with Judge Ireland as we continue to work with DOJ and our police department on continued initiatives. We put Commissioner Clapper and I put a number of initiatives forward. We are still hopefully awaiting with the City Council being able to move forward. They are holding up subpoena powers for our Community Police Hearing Board. We have a supervisor's contract which allows us to extend any type of complaint period, and also an assessment center for captains, he or she, on street management, which is extremely important. We're hopeful that the council will work with us on this. These are initiatives that have been put forth in working with the DOJ, Judge Ireland, Commissioner Clapper, and myself. So we have these teed up, ready to go, and we're hopeful that the council will move forward on them. Currently, they've decided not to and have kept them in committee. But again, if we're going to work together, these are initiatives that everybody agrees on and will be very beneficial not only to the police department, more importantly to the residents and business community of the city of Springfield. So I'm hopeful that we can work together to get that done. We must always remember, never forget, President Kennedy, marking the tragedy of his assassination. We did that yesterday on the 22nd with a small ceremony, staying within the COVID-19 coronavirus public health regulations. Congressman Neal and myself and Jim Sullivan, who's been long involved with it, doing that ceremony at Forest Park. That eternal flame is one of two that's been continuous in the nation here, so we're very proud of that in a tragic situation. I need to give some special shout-outs. One is to David Pedroza. He's a Putnam Vocational Technical Academy student. And I want to thank Chris Signoli and DPW and their crew. He is battling cancer. He's a wonderful young man. We met with him at his home outside with his family on Quincy Street early Friday afternoon. And Superintendent Warwick, I thank your teacher Kaylee Rogers. His dream is to work at DPW. He's a great student. He's battling cancer now, great kid, and we're all pushing and praying for him. But we were out there with DPW swag, some city swag, and of course he was tickled pink, Chris, when you brought the trucks down there and he was able to get on the trucks and be able to honk that horn. So David, you're in school right now, but just in case you're watching, we're very, very proud of you, and you're gonna beat this thing too. Also Saturday, and these are the nice things you do when you're mayor, to a sweetheart of a young lady, Pearlie Pitts, 92 years old. With her to wish her happy birthday from Maynard Street area. So Pearlie, you stay well. And the last thing on quick updates, it's a shot in the arm, morale boost, bright nights, and we need it more than ever. We'll open up Wednesday evening, and there's going to be some special nights for not only first responders, but for frontline workers coming up next week. So that's fantastic. On the police front, Deputy Chief Bill Cochran is here. He'll represent Commissioner Clapperud. We've taken a huge hit with the police department. We are down 25 officers to COVID. State police has been put on notice if and when we need them. We're supplementing with overtime. To those pain and you-know-what dirt bikes, I was very happy to see Friday evening on my way home from City Hall that police units had stopped a number of the dirt bikes and had them pulled over for confiscation. I know we're trying to get to as many as we can, and please call in because the police will track it. It gets very difficult, but I was very pleased that Commissioner Clapperud and Deputy Chief Cochran put those units out there. I witnessed it and saw it, that they were pulling them over with the dirt bikes on it. And they have the safety protocols. There was a Malden Street shooting, and the suspect, per usual, is being uncooperative. I'll let the Deputy Chief get into that, or what he can or cannot say. COVID-19, public health. We are now one-person cars, one man, one woman cars, to try to keep public health and keep our officers, he or she, healthy and protect our workforce. Fire Department, Commissioner Calvi is down 5, 31 quarantined. Coverage is there, but we are using overtime to do coverage. Also down 3 dispatchers. We had a great academy class of 10. The mini academies were doing graduation Friday, and it was just a very outstanding class, very diverse too. And the commissioner alerts me that they do have a lead, and they're following up on that Burlington Coat Factory store fire that occurred. Superintendent Warwick, meals are $4,374,210. Over 104,640 went out this weekend. Distribution this week, because of the Thanksgiving holiday, is Monday and Wednesday. High school sports, fall sports is finishing up. The MIA is delayed on their winter decision, so we're awaiting that. Schools, retrofitting continues to be done. Building fits pertaining to going above and beyond on the COVID-19. DPW Director Mcnally, he is down 1 with COVID. Yard waste is backed up, and they will get to it as they usually do. We thank you for your patience on that. Construction, he'll give you updates on the shutdowns and constructions dates. And snowplow drivers, we are still in need of snowplow drivers. Finances, CAFO TJ Plan indicates to me for FY21 we're down $1.7 million. Deficit spending since the start is about 6.6. Spending grants 7.6. If you total everything now with deficit and grants, it's $15.3 million, and we continue to try to offset as best we can, but we want to be able to provide for our residents and our business community. Pat Sullivan continues. I mean, he does have some people that are out with COVID and some being tested right now. We had a great announcement of Pinchin Plaza being completely reactivated. We're very excited about that. Bright Nights, as you know, will open. Pat's team is working very hard on not only school retrofits, but our municipal building retrofits. All tradesmen have now been completely trained on the I-Waves, and they're going to start to install them in our schools and our buildings. We continue to stock up on our PPEs to make sure that all our staff has them. We'd also like to thank the residents again for their patience. Parks is a little backed up on the leaf leaf cleaning, which will continue. We will get caught up on that. Economic Development Chief Development Officer Tim Sheen indicates to me that we continued with our fund to assist residents with mortgages, rents, and utilities at Wayfinders. And we're anticipating another stimulus package. In speaking with Congressman Neal over the weekend, we're hopeful another stimulus package. Maybe something during the lame duck session. If not, obviously going into January. So we're going to, Timmy has reached out to accounting firms, and we're going to try to get some technical assistance to the nonprofits and churches, especially the minority nonprofits and churches who need that assistance to try to go after this stimulus money. Law update, status quo from Solicitor Pakula, Bill Mahoney and HR Labor. Again, state was 9.8, we're down to 7.4 unemployment. National was 6.9. Springfield's numbers have not come in at this point in time. So that gives you a brief synopsis of overall city and overall COVID-19 operations. And with that, I will now turn it over to the President and CEO of Bay State Health Systems, Dr. Mark Kerouac. Thank you.
Good morning, everybody. Good to see you here. Thank you, Mr. Mayor, again for the opportunity to share this podium and for the cooperation of your whole team. The COVID-19 virus has continued to spread rapidly across the world, across the United States, and across Massachusetts. We're now at 58 million cases across the world, 1.3 million deaths. The United States has surpassed 12 million cases, and we're nearing about 200,000 new cases every day. Although death rates have not gone up as fast as new case rates, they're still substantial at about 1,300 deaths per day. Many hospitals in the Midwest and in the mountain states are at capacity, and we're seeing the return of refrigerated trucks to be used as morgues, a rather sad sight. Closer to home, Rhode Island, which has had a much higher rate of new cases than Massachusetts, has announced a 2-week pause, a rollback of some of their reopening guidance. Here in the state of Massachusetts, we now have over 200,000 cases, over 2,500 new cases per day, and 10,300 deaths. The number of patients in hospital exceeds 900, and that's a tripling in just the last 2 months. That's across the state. You'll recall about a month and a half ago, they recalibrated that public health map that they use, the red, green, yellow map that shows town by town. And the number of red towns went down from 121 down to 16 because the criteria were much more strict. Well, now, even with those new stricter criteria, the number of towns in the red is up at 62, and it includes 7 towns here in Western Mass: Springfield, Chicopee, Holyoke, West Springfield, Ludlow, Hampden, and Southwick. And there are a dozen other towns that are in the yellow. At Bay State Health, in September, we got as low as 8 cases in the hospital. And over the course of the weeks in November, we more than doubled and got as high as 90. We've now declined to 70, in the 70s these last few days. Today, 75, with 68 at our Springfield campus, 7 in our community campuses, and 9 in the ICU at Springfield. However, I don't expect that to hold given Thanksgiving. We're likely going to be seeing another spike in mid-December. We are testing up to 1,000 a day. We have no issues with personal protective equipment. We expect to have more testing come online, partly as a result of our own additional capabilities, but also through cooperation with UMass Amherst. With the students going home, some of the routine testing done for students will now be able to be pivoted for folks in our communities, which is a good thing. We also are gearing up to be a regional infusion center for the monoclonal antibody infusion. You'll remember a few months ago I said that in 2021 we wouldn't be talking about convalescent plasma anymore because we'd have something better called monoclonal antibodies. Well, Lily's has been certified under emergency use authorization, And yesterday, the Regeneron product was also authorized. We should be able to do up to 18 infusions a day in a special unit with a separate ventilation system at our Springfield campus. There's a state-based allocation with a lottery system, but I think it's very important for folks to realize that this is a very narrow needle to thread. It is very clear that there are some people who are made better by this product and some who may even be made worse. The drug is authorized for people who are at high risk to get really sick with COVID before they're sick, before they're sick enough to be in the hospital or to require oxygen. So a typical case might be an elderly individual with diabetes who just got the diagnosis but is still well enough to be at home. They can actually be helped by the monoclonal antibody. If that same individual waited until they were sick and needed oxygen, they might even be made worse by it. And so it's very clear, it's important for people to realize that this is not some magic wonder drug, as you might have read in the media, that's going to benefit everybody regardless of where they're at. The other good news of the weekend was that a third vaccine, this one made by AstraZeneca, announced strong effectiveness data. This is a more traditional vaccine that is made with the inactivated spike protein of the virus, we're very pleased to see that we'll have at least 3. I'm expecting we may even have a 4th by January. There is a work group at Bay State planning the logistics of the distribution, and the state has filed a draft plan that's been accepted by HHS in terms of its receipt of vaccine and how that's going to be distributed. In terms of surge capacity, we would be able to open 236 beds at the Springfield campus and another 150 in the community. So even with 75 folks in-house now, we're very far from being at capacity. We still do wrestle with staff because we have a number of vacancies, but we're continuing to work that, and that's something we've been able to figure our ways around. To give you an update on the cluster of employees and patients who were infected, it was reported last week. There are 47 employees and 10 patients who have been part of that cluster. We have completed our testing protocol for the many employees and patients that were on the unit or connected to the unit, and the unit has undergone deep cleaning, so we have really concluded our investigation of the outbreak. We continue to follow guidance across the campus and across our system to keep people safe. This includes, unfortunately, visitor restrictions at Bay State Medical Center, and people should not be deferring regular care because of concerns about contagion. Just a couple of other more broad public health points to make. There was new data that was published yesterday in the New York Times that showed a correlation, that is to say the states, like Massachusetts, that followed the strongest restrictions now have the fewest new case numbers and the fewest new hospitalizations. That was in yesterday's New York Times. And it does corroborate the value of following the guidance more broadly. We were also proud to see in yesterday's New York Times Magazine the story of the Bay State Health Supply Chain team that went down to get a $3 million shipment of masks, both N95 and routine masks, and had a bit of a tussle with the FBI and Homeland Security. It's a great story to read, and I commend it to you. We have joined with 100 other leading healthcare systems across the nation in the Mask Up campaign, so you will see public announcements about the importance of wearing a mask, both for yourself and for those you care about, and we would urge you to follow that guidance. And then lastly, I'm aware that Thanksgiving is coming, and there is certainly going to be a lot of travel in spite of some of the guidance not to travel. The CDC has come out saying that the safest thing to do is not to travel and to have celebrations just in the immediate household. If people do decide to travel, as I had mentioned in weeks before, they ought to be making a plan on how to reduce the risk. It's really not too late to do that. They should consider the virus burden of where they're holding the gathering as well as where people are coming from. My hope is that people thinking about traveling or thinking about hosting have been lying low and not interacting too much before coming. I do see that there is a tremendous rush on demand for testing, which suggests to me that people are trying to get tested before traveling. But people need to remember that this is not a free pass. A negative test today may still mean that you might turn positive tomorrow or the next day. It usually takes 3 or 4 days after an exposure for a person to have enough virus to test positive. And so people should not draw false comfort from a negative test. It's not a substitute for masks, distancing, hand washing, etc. The other key things to remember, high-risk individuals, meaning the elderly, people with diabetes, obesity, high blood pressure, should really think twice about joining a gathering of people outside their households. People with symptoms, whether you're hosting or traveling, ought to really change your plans and not go. Then the usual things, outside is better than inside, small groups better than large groups. Consider ways to improve the ventilation of the spaces you're going to hold these events, and try to observe distancing and masking when you're not eating. Plated meals are better than a buffet, and you might want to think about designating somebody to monitor compliance with these odd rules for gatherings. Finally, I'm going to, that all-American holiday, Black Friday, is probably the ideal super spreader event if you think of the videos you've seen of people crowding in stores and whatnot. And so I would strongly urge people to think about doing it online this year and avoiding those crowds. I'd strongly urge retailers not to try to lure people into their stores physically, and if they do, to really insist on the masking within the stores. So with all those caveats and all those buzzkills, I will still wish you all a happy Thanksgiving, and hope that you enjoy and are thankful for good health, and thankful for the fact that summer's coming, and we will have a way through this terrible time. So, Mr. Mayor, thank you for your time. Appreciate it.
There is no truth that Dr. Mark Kerouac is the Grinch this year, so okay, let's leave that out. Without further ado, we'll bring up Dr. Robert Roos, the Chief Medical Officer of Mercy Hospital Trinity Healthcare. We all need a laugh anyway.
So thank you, Mayor, and thank you to your entire team as well, and also to the media for continuing to report out amidst the pandemic here, such important information. This is a pivotal week. When we look across the country in a year that's been full of challenges, this week stands out to me as a very important week in regards to the future of the next several months in terms of transmission of the coronavirus and how hospitals all across the country are going to have the ability to collectively handle it. Thankfully, this morning, the situation at Mercy Medical Center is not much different than it was last week. We do have 14 hospitalized patients, of which 5 are in intensive care. So we are still seeing a very acute illness, but the numbers have leveled off a little bit after the sudden increase that we saw 3 to 4 weeks ago. We are, however, continuing to see significant community spread. The number of new infections continues to go up, and our test positivity rate now for 3 weeks in a row has been at 7%. Yet, despite the numbers of hospitalized patients not having dramatically increased in the last 2 weeks, my concern certainly has not lessened. The numbers, as we just heard across the state, have continued to rise. We have over 2,000 new infections per day, a test positivity rate statewide of about 5% when we take out the repeat tests from institutions of higher education, and there's almost 900 individuals hospitalized with COVID across the state currently, and 25 deaths per day. We've also crossed that threshold of 200,000 confirmed infections and over 10,000 deaths since the beginning of the pandemic here in Massachusetts. As was mentioned, our surrounding states are also experiencing similar trends and surges, evidenced by the fact now that all of the states, except for Vermont and Hawaii, are now on the Massachusetts travel advisory list. And the article yesterday did highlight that it's no shock that those 2 states remain with the lower numbers of infections and hospitalizations as both Vermont and Hawaii, while very different geography, instituted some of the most stringent restrictions earlier on in the pandemic and are faring better than all other states at this point. When we look across the country, the level of concern continues to rise. There's now more than 12 million infections, with more than a quarter of all the total infections this year now having occurred in the month of November. We still have almost a week to go, and there's been more than 3 million infections. We're averaging over 170,000 per day and are approaching 3 consecutive weeks with daily new cases over 100,000. Hospitals across the country are reaching capacity, and while we're in a different situation than we were in March and April because there is more PPE and sufficient numbers of ventilators. The concern is really about the trained personnel that have to don the N95s or operate the ventilators. This is no small concern. Hospitals in the Midwest, in the Great Plains, are struggling with capacity, and if it can happen there and the virus spreads here, it could also happen here. This is a different context than March and April, where as a country we were only seeing about 60,000 new cases per day at its maximum. Here in the Northeast, we were the ones that were treading water, trying to keep our head above water at a time when we were learning a lot about the virus, and rising numbers of cases and illnesses were coming into our hospitals and stretching our resources. We were learning about a virus that was less predictable than some of those viruses before it. We were also learning that this virus proved to be extremely potent and in some cases baffling. But we redesigned our operations as healthcare systems, from our facilities to our processes to our personnel, in order to keep patients safe. And as a community, we pulled together in many, many different ways. At Mercy Medical Center and at hospitals all across the country, we felt this very, very, very tangibly in what was unprecedented collaboration, from schools and universities offering up residence halls to help house colleagues, from staff coming from other states to help provide care to those most needy, from local restaurants and businesses offering meals, to the countless people offering support, gratitude, and prayers. But perhaps most importantly, in March and April, that was very different. We were feeling the support by all the members in the community following the guidance we've been talking about in terms of staying home, being physically distant, wearing masks, and finding new ways to connect during hard times. And as a result of that, we pulled through. There's some very challenging circumstances. Here in Massachusetts, we suppressed the virus to extremely low levels. At Mercy, we managed to get down to 0 hospitalized patients on 3 different encounters, and regionally, the numbers were just in the teens. And we were all able to enjoy a summer that was full of getting back to some of the things, although not all, that are important to us, including small outdoor gatherings, schools, and businesses. And so, this Thanksgiving week, I've been giving this a lot of thought. And despite 2020 being unlike any other, and it being full of great challenge and pain and tragedy and loss, I do think there's a lot for us to be thankful for. At Mercy, we're grateful for the over 2,000 colleagues, the nurses, the techs, the therapists, the providers, the EVS, the dietary workers, and everyone who continue to show their commitment to keeping our community safe. The courage to come into work every day and the resilience to do it, even though we know we've got a long way to go. We're grateful for the support of Trinity Health, a large national healthcare system who's continued to provide guidance, as well as the resources to ensure that we don't run out of PPE and our stockpiles remain adequate as they do today. We're grateful for you as the patients who continue to trust us for your care, both in the inpatient setting as well as in the outpatient setting, to get the studies and tests that are important for you to maintain your health, from mammograms to colonoscopies to visits. We know that this is important for you to maintain your health, and it's important for us to maintain those services. We're grateful to our laboratory teams who have dealt with constant challenges in acquiring reagents, shifts in recommendations and guidelines, who work day and night to process samples on now 4 different platforms. And today at Mercy, we're going live with another one, the Abbott ID Now, for symptomatic patients in the right setting, to be able to increase our capacity. I'm also grateful for the visitors who have understood that when we've made restrictions, it's been because out of abundance of caution and wanting to make sure that they and their loved ones are safe, and that we can communicate with them via phone and iPad and other means. I'm also very grateful for the collaboration with local healthcare systems like Bay State Health and others who've shown us all that we can share knowledge and work together and prepare for things and new challenges, like any regional surges of patients or setting up ways to deliver monoclonal antibody treatment to our patients. I'm also grateful for the support of the local and national delegation who have not only shown up to learn about this virus each and every day, but also shown us as hospitals and healthcare systems the support that's critical to our immediate and long-term success. But more than anything, looking back on this year, I'm grateful to those of you that have continued to heed our advice from day one and continue to keep yourself and others safe by wearing a mask, by being cautious about where you go and who you interact with, and by staying home if you're sick. This Thanksgiving, wearing a mask and not having a large gathering is one of the greatest gifts that you could give to our community. We've unfortunately seen spread of the virus amongst each of our previously celebrated holidays, starting with Memorial Day, then July 4th, then Labor Day, and Halloween. But with this holiday, one where we're taking stock of the things that matter, as we move into a colder season and the rates are overall higher, the stakes are also higher. There is a lot to be hopeful for in 2020-21. We've had recent announcements about the vaccines, which now 3 showing a high degree of effectiveness. But we're still some months away before that could be widely disseminated and administered. And so it's really imperative that we do collectively have what we're calling a safe Thanksgiving so that we can have a safe holiday season and New Year to follow. You know, personally, we're all being asked to make changes. Thanksgiving, myself, it's one of my favorite holidays, if not my favorite. And it's been my tradition over many years, living away from much of my family, to travel back to Chicago in most cases, to spend time with my parents, my brothers, sisters, nieces, and nephews. But this year, that wasn't the right decision to make. So me and my wife and our son, we're staying here, local, with our immediate family. We're still going to eat, we're still going to cook, we're still going to spend time outside, but we're going to zoom in the rest of the crew. It's that type of decision making that can help us all become safer. So please, think about how you can do things differently this week. Not only to keep yourself safe, but to protect our frontline workers, to protect our schools, to protect our businesses. The Centers for Disease Control has given some excellent guidance, as was reviewed, and would encourage you to think about it. Also, if you're looking for some additional information, or to speak to somebody else, or to have your questions answered about holiday preparations, there's going to be an event tomorrow. That's a collaboration between the Public Health Institute of Western Mass, Bay State Health, and Mercy Medical Center, airing on local television at 4 o'clock tomorrow afternoon. There will be a town hall where the experts review practices to keep yourself safe, answer questions about vaccinations, and review some of the public health principles that have gotten us this far in the pandemic. So again, thank you. Thank you for what you've done. We've shown a lot over the course of this past year, but thank you even more for what we're going to do in the future together. Let's not stop now.
Thank you, Dr. Roos. We'll now have Dr. Kerouac. Dr. Roos, up for any questions or comments from the media, Audrey Russo, Western Mass News.
I wanted to ask you guys about vaccines. For those of you who saw it, I put out there actually numbers, Moderna and Pfizer. And although you mentioned that it's not
Yes, the question of are we ready to administer and store the vaccines as soon as they're authorized by the FDA? We have purchased a couple of minus 80 degrees centigrade freezers that can store up to 100,000 doses of the Pfizer vaccine. It's worth noting that the draft allocation and distribution plan the state has submitted to the federal government stipulates that for any given region, we would probably have only one type of vaccine, so there's no confusion about dosing or boosters or whatever. The other two can be stored in a regular refrigerator or freezer section of a refrigerator. So we're certainly ready for that piece of it. The logistics of how to get thousands of people vaccinated in a big hurry, we are working through. What's the best place? What kind of place? You know, is it drive-through, walk-in, et cetera? We're working that out.
We're at Mercy Medical Center and at Trinity Health of England. We're in a very similar place. We've also acquired the types of freezers that would be needed if the Pfizer vaccine is the one that is ultimately distributed locally. And we're preparing our plans to be ready as soon as that's available.
And do you guys have any like choice in the matter as to which vaccine you get? It's just a matter of which one is approved first and just kind of comes down to which one first?
Not that I'm aware of.
Yeah.
Not that I'm.
I'd be happy with any of them.
Yeah. Yeah. Not that I'm aware of.
Doctors, is there any concern at this point, given the sluggishness of the transition and how that could affect, so a lot of this distribution is going to happen under the next president, not under the current one, about how it's going to affect your hospitals and hospital systems' ability to implement vaccination to the extent that you are a part of the vaccination program?
I think that the question is about the transition between the Trump and Biden administrations and if that's going to affect us locally. I think the more coordination that happens, the better. These are complex logistical issues in terms of deciding who gets how much vaccine, how you allocate a central supply across the states. Right at the current moment, as bad as things are in western Massachusetts, they're not nearly as bad as they are in South Dakota or Utah or Wisconsin. And it will be important for us to understand what the rules are and how we get our fair share of vaccine. And so the more coordination that happens there, the better. And the sooner it happens, the better.
Okay, Dr. Roos?
I don't have anything else additional to add.
So right now, right now, as it stands, you guys don't know how many doses of vaccine you'll get in the first round, in the first wave.
Right. In terms of how much there is currently nationally, there's roughly 20 million doses of the Moderna vaccine and 15 million doses of the Pfizer vaccine. There's another 35 million doses of Pfizer that's elsewhere in the world, but it's a 2-dose vaccine, so figure maybe close to 20 million individuals will be able to be vaccinated by early January. And the question of how you divvy that up amongst the states and how the states then divvy it up amongst the various regions is something that has been put to paper, but it's not really been carefully in a detailed way executed.
Risk of getting into a bit of minutia about that, I mean, because this is a 2-dose process separated by several weeks, I mean, is there any consideration of the fact that, I mean, there's still going to be manufacturing vaccine in that period between the first dose and second dose, so I mean, is planning just assuming that the doses that we have are just for 20 million people, or is it like kind of like, there's obviously going to be some coming out in that time period as well, like is it more of a wave as opposed to 20 million people start and, just kind of going with that?
They're going to continue to ramp up production, so more and more vaccine is going to become available, but they're estimating that they're not going to have more than the 35 million doses I mentioned by the end of December. And there also are some complex logistics for any 2-dose vaccine because you don't want to give somebody 2 different lots of the same vaccine. So you'll need to have ways to store the vials that have been used for individuals for shot 1 before they come for shot 2. So it's complex. There is one of the vaccines that is a one-shot or one injection vaccine, which would have some advantages for sure. But we're a ways from that vaccine being approved, and it's not clear, what's going to be distributed. But I think the idea that we're going to actually have 3, perhaps 4, perhaps 5 really good vaccines means that we'll be able to accelerate things much more quickly than if we were dealing with just one manufacturer.
And with respect to, I'm sorry, it is minutia as well, but,
This is all about minutia. This is all about logistics, right?
when it comes to the actual, physical distribution of the vaccine, I know the state has put out kind of their timeline as to who pays what when. Is it conceivable that, you guys are hold on to some vaccine and have to distribute it to doctors' offices, or are the vials at Bay State University going to get just for Bay State University medical workers?
The vials that we would get would be for people who fit certain criteria. So if somebody, let's say, is a healthcare worker at Shriners Hospital and has a doctor at Bay State, they might well get their vaccine at Bay State. So it will be more rules-based rather than organization-based. Does that answer your question? Yeah.
No, that's my
Paul, do
understanding.
you have a minutia question, please?
No, I'm going to change the topic.
Okay, Paul.
Vaccines. You mentioned the New York Times story yesterday about the correlation between states that have put in tough restrictions and how they're doing now. The outlier appears to be Rhode Island, who did put tougher restrictions in place, but now we're seeing a real explosion in cases. And you mentioned they've had to roll back some of their reopening. What do you think is going on there? Is there some lesson that we should be watching for in Massachusetts as a result?
Yeah, I don't know. I've not been following the Rhode Island story in detail. I would observe that the population density in Rhode Island is much higher than it is in Massachusetts. And I'm not sure in terms of the acceptance of the guidance as well. There is, when you look at the correlation and you put all the states on a graph, it is a bit of a scatter plot, but there is a clear relationship. And there are some that are a little bit off the line, if you will. But just the same, and so that may have to do with other special factors related to the geography or the extent to which the guidance was accepted and followed, too.
Nothing else.
Okay, just one question for Dr. Kerouac. Have you traced the source of your recent outbreak at the hospital?
I don't think we could say it definitively at this point.
Any other questions? Matt?
Just one other question, Doctor. You both said that your current patient levels have been stable for the last week, and I realize it's just 1 week, and they're even statewide. We saw some declines over the last couple of days, or fairly budging. I'm noticing a similar pattern in Connecticut's numbers as well. Do you have any insight as to how we're still seeing record numbers on a day-to-day basis of cases and not necessarily seeing it translate or lagging more so? Because it looked like our patient numbers were going up, roughly 2 weeks or so following the increase in cases, and now it's just kind of leveling off. Is there any scientific or epidemiological theory on that?
So, typically what you would see is the rise in cases followed then by the rise in hospitalizations and deaths, although certainly we've seen that to a slower degree, to a lesser degree during this wave as opposed to the prior, because of many of the things that we've talked about. When I look at the daily dashboard, you'll notice that the average daily numbers of new infections and the test positivity rate have just started to decline a little bit, but the hospitalizations are still on the uptick. And so I have not yet seen, while we've had an experience over the past 7 days that it hasn't continued to increase significantly, it does still appear that statewide it is increasing, albeit slower than maybe it was a couple of weeks ago. We had a holiday now almost 4 weeks ago with Halloween, and we can, I think, trace back in many situations events, gatherings, holidays where people tend to congregate together, with often being the impetus for some more community spread. And it's possible that if it's a spike related to a particular defined day like that, then it's not going to be as sustained as it would be if there is a wide-scale change in behavior over several weeks.
Dr. Kerouac? Any other questions or comments? Okay, thank you Dr. Carroll.
Mayor.
Thank you.
Happy
Happy
Thanksgiving.
Thanksgiving.
Yeah,
to you and your
thank you. Happy
families and
Thanksgiving.
staff. And thank you for what you continue to do for us. Appreciate that. We'll now move away from the minutia part of our press conference and go into the presentation from Commissioner Helen Calton Harris on our public health aspect here in the city. And again, to the media, thank you. All the questions are important. It's the people that I run into are very appreciative of getting out this information. So, but we need to laugh every once in a while. Our Dr. Anthony Fauci, Commissioner of Health and Human Services, City of Springfield, Helen Calton Harris.
Thank you, Mayor, and as always, you are the best. Appreciate your support. Thank you to Bay State Health and Mercy Trinity. It is amazing to have these two hospital systems and these leaders who come with us and give us credible information every Monday. So thank you. I'm not going to repeat the statewide numbers, but in Hampden County, we have 14,404 positive cases. The deaths in Hampden County is 883, and in the city of Springfield, the mayor has told you, we have increased by 3 deaths, and we are at 136. The average age of hospitalizations in the Commonwealth is 66, and the average age of deaths is 81. I'm going to go over our dashboard that you see in front of you. On board number 1, you'll see a confirmed COVID-19 case 3-week total comparison from November 1st to November 21st. The week of November 1st, there were 399 cases. The week of November 8th, there were 697 cases. And last week, we recorded 632 cases. That is 65 cases fewer than we had the previous week. Confirmed COVID-19 cases, November 15th through November 21st. On Sunday, there were 62, Monday, 109, Tuesday, 44, Wednesday, 98, Thursday, 104, Friday, 96, and on Saturday, we recorded 119. As the mayor said to you, we will be reporting from Sunday to Saturday now. If you recall, last week, I reported on Sunday there were 30 cases. Another 32 came in the next day. So in order to give you complete data, we will report from Sunday to Saturday. In the city of Springfield, confirmed COVID-19 cases weekly comparison. As you can see, looking back 3 weeks, the blue is the week of November 1st. The orange is the week of November 8th, and then the current week of November the 15th. And as you can see, the cases have escalated. We are still seeing cases in record numbers. However, last week's cases were higher than this week's cases. Let's look at the ages, which is on board number 2 to my left. And we see 30 years and under is 44% of our cases. 31 to 50 is 35% of our cases. Together, that is 79% under the age of 50. If you recall, last week that number was 73, which means that there have been an increase of about 6% in that group under the age of 50. So the under the age of 50 age group still is a concern as far as risk behavior is concerned, and the numbers increasing. The 51 and older age group is 21%. If we look at the cases by age group, just looking at the cases purely, the 0 to 10, there were 61 cases. 11 to 20, 96 cases. 21 to 30, 119 cases. So 43.6% of our cases were under the age of 30. 31 to 40, 115 cases. 41 to 50, 106 cases. 51 to 60, 76 cases. 61 to 70, 40 cases. 71 to 80, 13 cases. 81 to 90, 5 cases. And 91 to 100 was 1 case. And so, under the age of 50, again, is 79%, but under the age of 40 is 61.8% of our cases. The cases by zip code, you can see this is on board number 2 to my left. You see the 01109, 2, 01103, 10, 01104, 121, 01105, 48, 7, 52, 8, 117, 9, 128, 18, 55, 19, 35, 28, 8, 29, 23, 51, 31, unknown, or we could not determine, there were 2. I'm going to look at this more deeply by population because I think it is important. While I have reported to you zip codes where the numbers were high, it's important that we look at the populations as well in those zip codes. And so 01101, the population that registered, and this is the city's population from 2014 to 2018. So we recorded 0 population in 01101 at that time. This week, there were 0 cases in that. In 01103, the population is 1.6, and this is based on a population of 153,000. So 1.6 was the population in 01103. This week, it's 2% of the cases. In 01104, 01104 has 18.6% of the population and had 19% of the cases. 01105, 7.8 of the population, 8% of the cases. 01107, 7.6% of the population, 8% of the cases. 01108, 18.2% of the population and 18% of the cases this week. 01109 has 19.3% of the cases and 20 of the population and 20% of the cases. 01118 has 9.8% of the population and 9% of the cases this week. 01119 has 8.9% of the population, 6% of the cases this week. 01128, 1.7% of the population, 1% of the cases this week. 01129, 4.4% of the population, 4% of the cases. 01151, 5.8% of the population, 5% of the cases. What is important about that is, as I have reported to you, those zip codes that have high case rates, they also have high population. So the population is pretty consistent for the most part with what we're seeing in the numbers of cases. Now, I don't want anyone to think that this is good news, because this is not where we should be as a municipality, but it is important just to acknowledge that the zip codes that have the most populations have the most cases, and so it does not mean that we are disproportionately representing the numbers at this point. So it's pretty consistent with the population. The map on the floor, the map of the city of Springfield, that map is showing you just the cases from November 8th that are red dots to November the 19th. And when we look at board number 2 and we're looking at the races, we have a large unknown, and that's always a concern. But when we look at those data gathering sheets and we just see where it says unknown or it says other, we have been told that other is Latinx, and so that's what you will see in those numbers. So last week, Black African American was 11%, Latinx 28%, white 31%, and again, that unknown was 28%. The travel orders remain, and you've heard them already, from the physicians that Hawaii and Vermont are the only 2 states you can come to Massachusetts from that do not require a negative test within 72 hours or quarantine for the 14 days. You have heard about the very important face covering mask mandate that is in place. I have heard from some of you who have called me, and I appreciate your phone calls, and you talk about your medical conditions, and you cannot wear a face covering. What I would say to you is that if you do have a doctor's note, then just carry it with you if you should be asked for it. Perhaps it should not be necessary, but what you're saying to me, some of you, that you're not allowed in places like houses of worship and other places because you don't wear a face covering. If you simply say, I have a medical exemption, that should suffice. And so I am hopeful that that will help. If you continue to have challenges, please call us on our hotline, and we're happy to help you with that recommendation or tell you what you need to do. I'm mentioning this because I've heard from 4 individuals last week, and I just want to make sure I'm acknowledging that there is an exemption. Thanksgiving, you have heard again about Thanksgiving, but you should have a family plan. You should make a plan as a family prior to individuals coming to your home. Make sure individuals are wearing a mask. Evaluate the risk. Individuals with chronic diseases, as you've heard, asthma, diabetes, hypertension, any other cardiovascular disease, please evaluate your risk. Opt for outdoors. That is probably not going to be possible for us in the Commonwealth, but if you can do something outdoors, that is preferable. Limit the number of individuals who attend. All of us want to have our family with us. Again, as you've heard over and over again, please limit the number of attendees and increase ventilation. It's important that you open a window. If you have interior air conditioning, please put that on. What we're trying to say is air circulation in the environment is the best thing that you can do when you're having individuals in your home. Discourage direct contact and encourage hand washing. I know all of us wash our hands constantly during dinners or gatherings, but we want to be more vigilant. Wash them often and limit the sharing of utensils and limit substance intake. Alcohol, marijuana is legal, and so I would say to you that we tend to lower our inhibitions when we've had some libation, and so it's important for us to understand that during this time, we should limit our substance intake, and when I say substances, I'm talking about marijuana, which is legal, and alcohol to a minimum, because we want to make sure people are not taking risks because they're not in a position to make good decisions because of their intake. The Department of Health and Human Services does have materials for neighborhood councils and businesses who want them, and we have handed many of them out, but we do have other flyers and materials in English and in Spanish. You can call our hotline, 750-3250. We will be happy to get those to you, or you can pick them up, or you can call the wonderful woman who works with me. Her name is Shirley. She is at 886-5018, area code 413. Shirley is bilingual in English and Spanish, so please feel free to call if you need materials. We are happy to get them to you. We continue to receive complaints about non-compliant businesses, although not the majority, and I want to be clear about that, but there are some. The face covering requirement is enforceable in businesses, and the governor has asked that businesses, restaurants close at 9:30 so people can be home by 10. It is also mask coverings are enforceable in gyms and other exercise places that you are. Again, that is, I get calls about particularly gyms, and I understand how difficult that can be, but lower your mask so that you can breathe and then put it back on. It's just very, very important that you do that so that everyone can be safe in that environment. We do not want to go back to a place where we have to close gyms, businesses, restaurants. So please adhere to the governor's guidance. He and the lieutenant governor put that guidance out so that all of us can stay safe. I want to again thank AMR for your partnership. We partnered with AMR, who gave Eastfield Mall a plaque, I believe it was Friday, and I joined them so that we could thank Eastfield Mall for allowing AMR to be on their site. It is a perfect site, and I will tell you, while I was there, the cars, I could not believe the number of cars that were coming to be tested, and that's good news. And Putnam has testing as well. That is stood up at Putnam. It is Transformative Care, or Fallon, that's doing that. They will close this Wednesday at 1 o'clock, I believe. They will not be there on Thursday. Obviously, it's Thanksgiving, but they will be back on Friday. You can find AMR schedule and Transformative Care schedule on the Stop the Spread website. There's also a link from the City of Springfield's website as well. We had a meeting on Thursday with the cold weather COVID-19 flu task force. I am extremely proud of the City of Springfield and our partnership. We discussed homelessness, how to make sure we're getting homeless individuals who are unsheltered into shelter. Catholic Charities was on the call, and so we were able to get some good guidance and information. Again, very proud of the work that we do together. The flu season is here. If you have not gotten your flu shot, please do. Everyone 6 months or older should get a flu shot. Please, I am asking, particularly if you have underlying conditions, make sure you're getting a flu shot. I can't say that enough. We are going into twin potential pandemics worldwide, which is COVID-19, as well as flu. And then there's a third one, which is the economic parity that we are seeing. I have witnessed and been in places and have helped and assist the food banks, the food lines, people with food insecurity. The lines are very long. People are hurting. There is a lot of pain out there around their ability to feed families and feel safe. I am pleading that if you have the ability to donate to a food bank, if you have the ability to help your neighbor, you may have an elderly person that is in your environment that may be struggling and does not want to ask you for help because of their pride. I ask you, please make sure that you are looking around your neighborhood and seeing and thinking about those individuals who might need your assistance. Again, they may not ask for it. I thank the Springfield Department of Elder Affairs and their reaching out to the elders in our community. If you have elders that you need support from, you can call the Ray A. Jordan Center and ask for Sandy Federico, and she will do all she can to assist you, particularly during these holidays. There are going to be events for our elders, and so we ask you, if you know someone, if you're in touch with someone, make sure you are reaching out to us. We are here to help. We are public servants, and what that means is that we serve you. So let us do that if you need our assistance. November, I want to give my sympathy to Daryl Bumpy Gibbs. He's a business owner and a friend of mine. I have several children that I've adopted over the years who have really been a support to me. And Bumpy's mom passed away from COVID-19. Her name was Annie Mcnally, and I just want to take a moment to give my heartfelt sympathy. I know how difficult this is to lose a parent. Our sympathy and our hearts and prayers are with you, Bumpy, and I know that you will do what's necessary to stay safe and keep your family safe. And again, our sympathies are with you. November is Caregivers Month, and I want to just take a moment to thank Mayor Dominic J. Sarno and the women of Alpha Kappa Alpha, Xi Xi Omega Chapter, who on Friday gave me one of the most amazing and emotional tributes that I've ever received. They read a proclamation from the mayor, which was absolutely beautiful, and I just very much appreciate the fact that they cared about me enough to give me that amazing tribute, and wrote a special poem for me that said, "You got me covered." And I know that you all do have me covered, and I thank you so much for your love and support. I have the best sorority in the world. I was going to say the United States, but it is international, so thank you very much. If there are caregivers in your life, whether they are frontline workers, or it's your grandparent, or it is your child, someone is taking care of you, or someone is taking care of each other. This is Caregivers Month. Please stop. Celebrate that individual. Tell them that you care about them, and tell them that you are thinking of them. I can tell you from what I experienced, it is a wonderful, wonderful thing to do, and it makes that individual feel amazing. It is about the blessed of us helping the rest of us. That is absolutely when you have your health, when you're able to get up in the morning and do your job, when you're able to be in a place where you're feeling healthy and well, then you're blessed. And so what our job is to help us with a can-do attitude. So it is the blessed of us helping the rest of us. Thank you to the Public Health Council for the City of Springfield, the staff of the Department of Health and Human Services who do go above and beyond. And again, thank you, Mayor Sarno. I am very much appreciative of your proclamation and certainly of your support. Thank you.
Thank you, Commissioner Carlton Harris. Thank you, Helen. Bumpy, I didn't know about your mom. My sympathy, thoughts, prayers, and encouragement. Great family, and very sorry for your loss. Difficult any time, but especially during the holidays. May God rest her soul. We'll now go into the public safety part of the press conference, and we will start with the Fire Commissioner of the City of Springfield, Bernard B.J. Calvi.
Thank you, Mayor. Good morning, everyone. As the mayor stated, we have 5 firefighters out with COVID right now. We have 3 dispatchers out, and we have 31 people awaiting testing and quarantine at this time to make sure everybody stays safe. That's a big uptick for us, but we work in tight quarters with one another, so precautions have to be made to make sure we can still respond to all the emergencies out there. On the other front, we had a fire at Burlington Coat Factory the other day. It was a arson fire. We have a person of interest in that investigation, and we're continuing on with that. Hopefully we'll have more information on that soon. Other than that, I'd like to remind everybody that Thanksgiving coming up, a lot of people are going to be cooking at home. Make sure you exercise safety while you're cooking. If anybody's going to attempt to cook a turkey, make sure you defrost it first before you dump it into the hot oil. That will have a catastrophic fire if that happens. And just everybody be careful over the holiday weekend. Stay safe, and happy Thanksgiving to everybody. Thank you.
Thank you. Thank you, Commissioner Calvi. And now with the police update, Representative Commissioner Cheryl Clapperud is Deputy Chief Bill Cochran.
Thank you, Mayor. Good morning, everyone. The Springfield Police Department currently has 25 officers out with positive COVID results, and we have 14 officers that are out with COVID testing awaiting the results. In the police department, we stay vigilant with our COVID protocols. We are now all in one-man cars, and we are practicing wearing masks, cleaning the cruisers and cleaning their workstations vigilantly, and social distancing. The police department had a busy weekend. We did on Friday evening, I think the mayor talked about it already, we had a shooting on Malden Street at around 6:25 p.m. The victim was hit several times by gunfire. He's expected to recover, but he was uncooperative with the investigators at the scene, and he was even went after he was released from the hospital. So this is an ongoing investigation that the detectives are coordinating. We continue to do serious enforcement on those rogue dirt bikes that everybody's seen riding throughout the city. We're doing the best we can to corral them and cite them or take whatever law enforcement action is necessary to curb that activity. And we are coordinating currently with the city of Springfield, the Spirit of Springfield for the opening night of Bright Nights this Wednesday to make sure everybody has a safe and good event there. So in that, have a great Thanksgiving. Thank you, Mayor.
Thank you, Deputy Chief Cochran. Thanks, Bill. On the school front, Superintendent Dan Warwick is here. He will give you an update pertaining to the Springfield School Department. Superintendent Dan Warwick.
Thank you, Mayor. Good morning, everyone. To begin with, on our food distribution, we continue to go at a tremendous rate. Year to date, we've distributed 4,374,210 meals. Just this weekend alone, 104,640. This week, our distribution is going to be changed, and we're going to distribute Monday and Wednesday. But again, it's going to take through the Thanksgiving holiday and through the weekend for our families. So same schedule, but again, on Monday and Wednesday, and you'll get the distribution through the weekend. With the mayor's support and Pat Sullivan and Helen, our health commissioner, we've had Bob Kirshner going through our buildings. That work continues, taking a look at all of our buildings, and again, looking at ventilation and prescribing exactly what we need to do to exceed the ASHRAE standards, which is our goal. And I believe there's only two school systems in the state that are working to achieve those standards that I know. And we're making progress with that. The orders are in, and we're doing all the work to get that mammoth task accomplished, and I can't say enough about Pat Sullivan and the team and their support with that effort. We are going to be running a major town hall meeting to get input from the public after Thanksgiving. We're working with Focus Springfield on that. They've been our partner for the one we ran in August, and as soon as they have the equipment and are ready to go, we're going to do that. And again, the opportunity for the public to give input. The last one we ran, we were able to have two-way communication in 6 different languages, so we're working to do that again, and there's considerable technology involved. Just as a reminder to the public, flu shots are mandated, and we're going to require them for students for school after January. So we're working, there's a lot of opportunity to get flu shots, but we're really encouraging families to avail themselves of that opportunity. That's going to be so important when we go back to school, that flu shot piece is taken care of, so we're not dealing with multiple issues at the same time. We're still distributing iPads to preschoolers. Any family who doesn't have one, contact their school. They can pick them up at the school, or we'll drop them off at their houses. We're using our transportation program for that. Our sports program, we're concluding our fall sports program right now. And our winter sports program right now, the MIAA has said they're going to delay the start. Usually the winter program starts right after Thanksgiving. They're talking about a delay either into mid-December or maybe into early January. So we'll get you more information as we have it. And again, that would be under the MIAA. Remember, for any family with technology assistance needs, we have a helpline to provide assistance with that. And since we've gone back to school September and October, our attendance, and we're taking attendance as we do traditionally, has been at 91.9%. And that's a tribute to the staff at our schools, our teachers reaching out to families and making sure families are getting involved, and our IT department responding to all those technical issues and getting them resolved so families can participate. It's an incredible accomplishment. I'm very, very proud of my staff. MCAS, we don't have a final decision on MCAS yet. Again, that's something that's being debated across the state and across the country. Again, we're going to have a new educational secretary coming on. I don't know what the ruling is going to be on MCAS. Most of the superintendents I talk to are against the MCAS right now. It doesn't make sense, given the interruption to instruction, to take the kind of instructional time we need to give an MCAS for the results we're going to be able to get. But there's no decision yet on that. As soon as we know, we'll let you know, because there'll be a retest in January for the 11th graders if we have to give MCAS. We're waiting word on that. Same with the access testing for our ELL students. And as you know, we did endure a pretty significant ransomware attack. We're in complete recovery from that now, and we're taking a look to see what, if any, information has been distributed. We haven't found any yet, but as soon as we do, we'll take a look at that and deal with it accordingly. But again, all of our systems now are fully operational in recovery from that attack, and I appreciate the great work of our IT department. Thank you, Mayor.
Thank you, Superintendent Warwick. And as Superintendent indicated on the town hall meeting, we're awaiting Focus Springfield as they're transitioning now, and they're transitioning their equipment. Besides that school meeting, again, I'll hold with Judge Ireland. I think it's either a third or fourth, or definitely third, community police, with Commissioner Clapper, community police relations, town meeting also, as soon as that equipment is being able to be transitioned. School and the police community relations with retired Chief Justice of the State Supreme Court, Rick Ireland, Judge Ireland, and Commissioner Clapper. So we're awaiting that on both, and how we're going to proceed as we move into the second semester of the schools on that. So thank you very much. Department of Public Works, Director Chris Mcnally is here. They're out there every day. Note, I'm sure he'll bring it up. Thursday is Thanksgiving, obviously. So for the residents who have trash pickup on Thursday, your trash will be picked up on Saturday. Again, for residents who have trash pickup on Thursday, your trash will be picked up on Saturday, per usual, when we go on our holiday schedule. Without further ado, the Director of Public Works, Chris Mcnally.
Mayor, thank you. The Department of Public Works currently has one employee out with COVID. As the mayor mentioned, our Thursday trash will be picked up on Saturday. We will be doing a press release on that today through DPW, Facebook, as well as through the mayor's office of communication, and we'll be coordinating that with Bill Baker. I also want to echo the mayor on what happened on Friday afternoon. David Mendoza, freshman at Putnam. I want to thank Scott Donnellan in my office, Jimmy Gibo, who we were able to be out there and honor the student fighting cancer, working his way through school, not missing any of the school dates. And I want to thank former city councilor Timmy Rook, who actually notified me of that a week or so ago, and we were able to set that up. It was a great event to be able to do that. Yard waste, we are behind. We are working, today is on last Wednesday, so hopefully we will start to pick up on that. Our construction, our permits for work in the street ends December 4th. That may get extended depending upon weather, but major construction projects will be shutting down basically at that point. There will be one or two projects that will continue to work throughout the winter that are time sensitive related to some major construction projects. DeBerry School, for example, there will be some work in that area. The city is still looking for snowplow drivers. The incentive period for a higher rate, excuse me, is this Wednesday, but we will be taking applications through the beginning of the year. So we are looking for drivers. The DPW also has a number of openings for drivers and for mechanics that are posted on the city's website. So if you are interested, please look at that and sign up. And if you have any questions, get in touch with us through 311. But there are a number of openings within our department. That is it, Mayor. Thank you very much.
Thank you, Director Signoli. Thank you, Director Signoli. Thanks, Chris. Again, the City of Springfield's in business of doing business, and Chief Development Officer Tim Sheehan and his unit have done a tremendous job getting money out to not only our businesses, but also our residents in need. So the Chief Development Officer of the City of Springfield, Tim Sheehan.
Thank you, Mayor. As the mayor indicated, we are seeing a little bit of an uptick with regards to people that are experiencing housing insecurity. What we are looking to do is to make sure that everybody is informed about the resources that are available. As we've indicated a number of times, the city has put $2 million into rent, mortgage, and utility assistance through Wayfinders. Wayfinders also has the RAFT program. So if people are feeling that insecurity, they definitely should be contacting Wayfinders to find out if they are eligible for assistance through the programming that we've provided. Additionally, as the mayor also indicated, we're anticipating that there'll be another round of PPP coming through the SBA. The PPP program was so beneficial to many businesses and nonprofits, but quite frankly, the Black and brown community did not receive as much assistance as they should have, and we're trying to ensure that we have the technical assistance available to help those nonprofits and small businesses in the Black and brown communities to access the assistance that's available. Thank you.
Thank you. Thank you, Director Sheehan. Thank you, Tim. You received the updates prior with the CFO, TJ Plan, on our finances, and on labor law and HR with Solicitor Pakula and Attorney Bill Mahoney. Pat Sullivan, Parks and Facilities, he's unable to be with us this morning, and you received his update. So at this point in time, we will open it up to any questions or comments of my cabinet heads or myself. Paul?
The reported in the Wall Street Journal this morning that the State Public Health Department had a video conference yesterday afternoon with municipal officials around the state. Was anybody
I will let Commissioner Carlton Harris, our point person, speak of that.
So that is my department was on. I do not have the update yet because it was yesterday and I have not seen it yet this morning.
Any other questions or comments?
Mayor,
Matt?
earlier you said that in discussing some of the negotiations with DOJ, there were various things that
Yeah.
they were approving of. Which ones were they, did they say that they supported or
Working with Judge Ireland, DOJ, Commissioner Clapperud. Again, we've had it before the council for quite a while, in an ordinance form too. Subpoena powers for our community police hearing boards. Also, on the complaint time frame, if there's a complaint that comes in, that would be extended. And also the assessment center supervised, that would be with the captains pertaining to scenarios and situations on the street. So those are things that have been put forth to the council, and I look forward to want to work with them, but those are things that everybody's in agreement that in working with the DOJ and working with Commissioner Clapperud and Judge Ireland, that would be beneficial to all involved, especially to our residents. So hopefully we can come to some type of
So those three things are things that you
That's
got
beside-
feedback from DOJ about?
Yes, yes. And that's besides the other initiatives that we have put forth already, from body-worn cameras down. I believe we are the largest, Deputy Chief Cochran, I believe we are the largest department, if not in New England, I believe, that is wearing body-worn cameras. We're well over 400. We're nearing all our officers, which is over 500 sworn personnel. And Commissioner No, Boston hasn't even done it. And Commissioner Clapperud's also ordered narcotics, which that unit's been completely revamped 2 or 3 years ago. And Captain Brian Keenan and team have done a tremendous job. And from my understanding, we have not received one complaint in the last couple of years on that. So we moved on a number of initiatives. We want to continue to work with DOJ and Judge Ireland, of course, our community, Commissioner Clapperud. But these are initiatives that are right now have been stalled or stuck in the city council, and I'm hopeful that that could come about. It'd be very beneficial in continuing to move the department forward. Any other questions or comments? Okay, I want to thank again the media. You're here faithfully every Monday, and that's important to get information out, and the minutia out also, because that's crossing the T's and dotting the I's. I want to thank my cabinet heads all the way down to rank and file. They are tested and true through a number of natural and man-made disasters. And I also want to thank the residents and business community of the city of Springfield. I know it's become very cumbersome and very aggravating, and we're all impatient to get back to a sense of normalcy, not the new normalcy, but normalcy. But it's just important, it's imperative. There is light at the end of the tunnel. You heard from Dr. Kerouac and Dr. Roos. Those vaccines are coming right around the corner, but in the meantime, we have to stay steadfast and follow the public health guidelines that have been put forth by Dr. Kerouac, Dr. Roos, Commissioner Helen Carlton Harris about, wearing the mask. It's not going to kill you to wear a mask. God forbid, it could kill you if you don't wear a mask. The washing of your hands, the social or physically distancing. If you don't feel well, stay home. I know the holidays is times that we gather together with our loved ones and our dear friends. We can't do it this year. You should only be with individuals that you have been with. And soon enough, in the very near future, we'll once again be able to come together and forget about the air hugs and be able to give a real hug and a kiss or a handshake and be able to celebrate our holidays and our traditions. But we need to stay ever vigilant right now. So your partnership is deeply appreciated. We will continue to coordinate with our hospitals, Bay State and Mercy. God forbid the spike continues and hospitalization numbers go up. Commissioner Carlton Harris indicated a very specific percentage. I believe it is now 79% of the new cases coming 50 and under. And 20 and under, or 30 was 44 or 40-something percent. So to our younger people, you are not invincible. You are not invincible. And if you don't want to think about yourselves, think of the loved ones you're around if you want to flaunt and not wear that mask. So we are going into the holiday season of Thanksgiving, and there is a lot to be thankful for. We will defeat this COVID-19 coronavirus pandemic, and I wish each and every one of you a happy and healthy Thanksgiving. God bless you all. Thank you.